Good morning, everybody. I'm John deSteiguer, the president of Oklahoma Christian University, and I'm so honored to be here with Shawna Hood. I'm going to interview her, and you're going to learn all about her, and you're going to love it. So we're sitting on the second floor over on the east side of campus. We're in the Dave and Shirley Ellis Clinical Simulation Lab, a part of our nursing program here, and it's an outstanding facility. You can see that we have somebody in the back also, one of our mannequins that is worked on by our nursing students and nursing staff quite a bit. Well, I'm glad you're with us this morning. Shawna, boy, thank you for being here. So I want to start and ask you, tell me about your nursing background.
Okay. Well, I've been a nurse now for over 20 years, and I first started out at Children's Hospital, working in their pediatric ICU. I actually quit my job in May of this year in order to go to New York. And I'm about 2 weeks from getting my job back. So that was my first job. And so I continue to work there just one shift a week during the school year.
So lots of years in nursing.
Correct.
Okay, so we had two of our nursing faculty members, Kim Langford and yourself, that went to New York City in the midst of the pandemic when it was hitting New York City so hard. Mm-hmm. Why don't you share your experiences about that?
Well, since I've been here, I really enjoy a challenge, and I thought, well, I would really like to see and be a part of that war effort that was happening. And it really doesn't matter which city you're in, but New York was the one at the time that was having the most issues. And so I went, signed a contract, and worked 4 12-hour shifts in a medical ICU where we were taking care of the COVID patients. And I hate to say it was really fun, but it was awesome.
Man, I mean, Shawna, thank you for going to the front lines there, and thank you for the service that you provided. I mean, I really view nursing as a ministry. I think it's such a special major when our students go into this because they're serving so many people. And of course, you and Kim did that when you went to New York, but you're also doing that here. So,
correct.
Dr. Jeff McCormick, who is our new Chief Academic Officer, he has also been in charge of our COVID Readiness Response Team. He appointed you, Shawna, as OC's COVID officer. And I asked him, said, okay, so Shawna's great, but why Shawna? And he said her expertise, her experience that she has had, and her care for people. So it sounds to me that Jeff agrees totally that you're the perfect choice for this. But why don't you tell me and tell the audience, as our COVID officer, what all does that entail?
It actually entails quite a bit, and if you look at the job description, it's about 5 pages. But what really it is that we're going to do campus testing for hopefully every faculty, staff, and student that comes on our campus. The reason this is really important is because we really do want to make sure that we limit the exposure to our people so that we can maintain our campus just how we're supposed to do it on a normal, regular basis. The testing actually is not mandatory. What happens after you get a test is hopefully you get a negative test, but if you get a positive test, that's when my role steps in. So you will be notified, you will receive a phone call as well as an email letting you know the proper steps to take right away. We're also doing some contact tracing. So if anyone tests positive, then anyone that they came into contact with that is greater than 15 minutes within 6 feet with no mask, we also are going to isolate those people as well. And it just depends on where you're at. So if you live at home, then you're going to isolate or quarantine at home. If you live on campus, then we are going to step in, make sure that every student has what they need, has meals delivered. We're going to contact everyone that has been in contact with this person. And then on top of that, we are sending out numerous emails to all students and faculty or faculty that student is involved with to let them know that it is 100% appropriate for them not to be in class. And with the use of our new Collaborate, we're going to work with those students in an online format until they're able to come back to school.
So they won't miss class.
They will not.
They'll be attending class from their isolated room or their quarantined room or
Correct.
somewhere. Okay, very good. Well, I want you to know that on Monday, I went and I provided enough saliva to be tested, and yesterday my results came back.
They were negative.
They were negative. That's exactly right.
And the only reason I know they were negative is because all results from yesterday were negative. So we have less than a 5% rate right now of COVID on campus. And out of those COVID positives, we only have one that may be showing symptoms.
Okay.
So that's really good news.
Well, I want to ask you a couple of things. Talk to me about masking and distancing and those precautions that we're going to be taking. How important are those things?
Very important. So when I was talking to my parents about going to New York, they did not want me to do that. And so I thought to myself, this is actually the only time in my life that I will have an opportunity to go to war. And so if you remember back to other wars that we've had where people say, how can I help? What can I do? And the way that you help is by wearing a mask. Whenever you are in contact with someone within 6 feet, your nose and your mouth should be covered because that is a known way to spread the disease. And of course, on top of that, we're going to be washing our hands, not touching our faces. In fact, when I was in New York and I was wearing the face shield and goggles and a mask, I would come out of a room and wash my hands, take off my face shield, wash my hands, take off my goggles, wash my hands, take off my face mask, wash my hands. So it really is a process that we have to be diligent about in order to maintain the safety of everyone involved on campus.
You know, yesterday I was walking around campus in a variety of places, and we have some students that are already back on campus. They're with our pre-semester engineering camp, our business boot camp as well. And I didn't see anybody who wasn't wearing a mask. I mean, the compliance is extremely high, both faculty and staff and students, and I was really pleased to see that. That's a much more normal part of society today, and I think that spells good news for OC. Okay, I want to go back to when a student tests positive. Walk me through what happens. The student's not feeling well or has been tested for some reason. The results come back positive. You find out about that automatically. And what happens with the student? How do we get them into quarantine? Tell me more about food being delivered. How do we kind of socially interact with them so they're not, totally by themselves, or at least feel like they're totally by themselves?
Well, first you get a phone call, and that phone call we're going to ask you what your needs are. Do you need a thermometer? Do you need meals delivered? Do you have any symptoms? And if someone says they don't have any symptoms, or they're living in an apartment and they have groceries, then we're just going to spot check them every day. They will get an email or a phone call just to let them know that everything's fine. What if they do have symptoms? Well, we have agreed to lay eyes on every student who is having symptoms. And additionally, every person is available, where there's going to be someone available 24/7, even in the middle of the night, just in case someone has issues. We also have the OCWA women who have talked about making care packages and doing visits. You can actually visit in person. There's nothing wrong with that for someone who is quarantined. But then we really are going to make sure we do the proper PPE, so face shield, a N95 mask, and if they're not changing their clothes right away, they'll wear a gown as well that they can throw away. If they're having issues and they need to see a physician, we'll make sure that they have a physician. My only request to the people coming to campus is that they put a little thermometer in their bag, because what we would like for those who are asymptomatic, meaning they have no symptoms, is just to monitor their temperatures every day. This is completely on their own. We don't have to follow up about making sure they take their temperatures, but it's just a good idea for you as a person to know if you might be close to exhibiting symptoms. And what research has shown is within 2 days of no symptoms, is when you're likely contagious, and then so if we can start to see that rise in temperature, that'd be a good way to know that maybe we need to be aware or start to look out more.
Okay, so I had conjured up in my imagination that when somebody goes into isolation or into quarantine, they're in a dark room, nobody ever sees them, they don't see anybody, you slide food under the door or whatever, but it doesn't sound like that at all.
No, that's absolutely wrong.
Okay.
In fact, I have taken care of loads of COVID patients, and I did not contract COVID.
Okay.
So as long as you're safe and cautious, it can be done.
Okay, that's good, because I know that people have talked about concerns about, you know, the emotional states of individual that are that might have to quarantine. My wife Darla is a member of OCWA, the Oklahoma Christian Women's Association, and I know even yesterday they were beginning to put together some care packages for students. So I'm really thrilled about that as well. Talk to me about contact tracing just a little bit.
So with that first phone call, we don't get all of the information that we need right away, and most of the time, because you're a little bit scared or nervous that you have COVID, even though you might not have any symptoms, and so we will also follow up the next day and the next few days, and making sure that we have contacted everyone who you've had contact with, meaning that you were not wearing a face mask, you're within 6 feet of someone for greater than 15 minutes. So of course that means everyone that they live with. So we will immediately put those students in isolation as well, which means isolation and quarantine you have COVID, isolation you've been exposed. And so after that we will just follow the student that is testing positive, and then we will check back regularly, and if they ended up not having symptoms, well, 10 days from then everybody is released from quarantine or isolation. I do agree with the emotional aspect of it, especially the first week on campus, because it's very exciting. So we want to make sure that we don't cause undue harm that way.
Mm-hmm.
But unfortunately, there really is no way to interact with others until they do have a negative test or they've had no symptoms for 10 days.
Okay, so that's very helpful for me to understand the contact tracing, because my imagination had gone to a place that said that if somebody tests positive, if I happen to have walked by them briefly outside, we were both wearing masks and we just passed like two ships in the night, that maybe that would be some sort of an alert for me. But really,
No.
it's if it's without mask, within close contact for a more extended period of time. That's really helpful for me to know.
Yes, so you can go to the grocery store, but we need to make sure we're wearing our masks. You can eat in a restaurant, but you're wearing your mask when you go in, and hopefully you have social distance yourself from everyone once your mask comes off.
You know, we're very concerned about our students and want them to have a great semester, both academically, but health-wise and spiritually and emotionally in all sorts of ways. But we're also concerned for our faculty and our staff as well. And so really, wearing masks is not as much for the person wearing the mask as it is for everybody else that they're having
Correct.
any sort of contact with.
As the chair of nursing, my worst nightmare is if one of our faculty has COVID. So we are going to do everything possible to make sure that our faculty stay safe and our students stay safe. In addition, nursing is still going to hospitals and taking care of patients. Hopefully we will not be on any COVID units, but that doesn't mean that they won't come into contact with someone who has been exposed or who might have it. They just don't have symptoms. So we're also making sure that when we go to our clinical sites that we're also following appropriate PPE in addition to just the normal mask wearing.
Well, so there's no question. I mean, just like in the world at large, COVID is going to be present on the OC campus
Correct.
at some points this semester. But it sounds like our mitigation and all the protocols that you are leading us and working us all through is really, really going to be effective and helpful.
That's our plan.
That's
we
our
don't want an
prayer as
outbreak
well.
on campus.
Right. Very good. Any final parting words of wisdom for our audience, or for me? Okay, so.
My favorite line is always make good choices and wash your hands. So,
man, that's pretty good. Always make good choices, always wash your hands, always wear a mask, always physically distance. We're so excited that the semester is soon going to begin. And man, we just keep going back to that thing that's so important to us, and that is, Jesus, what's the most important command? Well, it's to love God with everything, but the second command is like it. It's to love others just as yourself. And so that's what we are going to be doing this semester at OC. We're going to be loving God and loving each other and acting in the right way. I'm really excited that Shawna is a part of our community and leading us as our COVID officer. Thanks for being here.
Thank you.
Shawna.
I appreciate it.
God bless you guys.